Blepharoplasty is the cosmetic surgery of the eyelids. It can be done for the upper eyelids and the lower eyelids or the both eyelids. So you can see in this picture, so there is upper eyelids which is skin which is hanging down. So there is lot of loose skin and we remove or cut the extra skin, and the incision is always hidden in the crease. So what is upper blepharoplasty? So there is looseness of the skin due to gravity and due to aging in the upper eyelid. So we do upper blepharoplasty. We remove the extra skin and sometimes the muscle and the fat in the upper eyelid. So this is a very fruitful surgery because the results are very promising, and there is a scar which is in the crease. So scar is hidden in the upper eyelid crease. So we remove the extra skin and we do a fine suturing. Sometimes we remove the sutures, sometimes we use the dissolvable sutures, and you look very rejuvenated in the upper eyelid. If you have the hooded eyes, you have the drooping of upper eyelid, so we can do the upper blepharoplasty. So we are doing the marking for the upper blepharoplasty. So usually we do in the sitting position, but now the patient is lying down in the operation theatre. So we'll just lift the eyelid and we can see the natural crease. So this marking is very important. There should be a complete symmetry on both sides. The crease is 10 centimeters in the mid pupil. Yeah. So I am taking the incision. So first the lower incision. So we have already marked the crease. You can see there is very minimal of the bleeding. This is due to the action of the adrenaline. So it has to be done very meticulously. Then the corners we make an obtuse angle. So then I always lift the skin with the muscle sparing. So I'll lift only the skin. तो पंचे में साइड दे दें. We have used the eye shield to protect the eyeball. You can see this is only the skin flap we are excising. Next step is, if there is any bleeder, we can do the bipolar cautery. So this is the cautery to stop the bleeding. There is hardly any bleeder. You can see this is all meticulously done. Then the next important step is we have to create a crease just 2 millimeter above the lower incision. So I'll do a linear cautery to create a depression there to create a natural crease. So the third step is optional, because if in the preoperative diagnosis you feel there is a herniation of the fat, which is lesser chances in the upper eyelid, so we can do the fat removal. But in this case I am not planning. Otherwise you open the medial compartment, you incise the muscle and open the medial compartment to reach the fat. But in this case we are not doing the fat removal in the upper eyelid. So similarly I'll repeat on the other side. So first I'll take the lower incision over the marking. So the lower incision is the crease. So this crease is already made by God. So we are following the crease and we are keeping it same on both sides. Then on the sides, as I told you, not to cut straight, we have to make an obtuse angle. Inner side also obtuse angle. अंदर में जाएगा मैं marking obtuse angle. Then the upper incision. So this all seems very easy because I have done the marking beforehand, and because of the experience we know wherever the marking is there we have to cut in that over the line to give the symmetry on both sides. Then I have to raise the skin flap again. So this skin cannot be removed without surgery. So there are many non-surgical methods, but the result is never comparable to surgery, because you can see this is a lot amount of the redundant skin which has been removed permanently. Again the cautery, the bipolar cautery, wherever there is a bleeding. Then the next is I have to create a natural crease. So just 2 millimeter above the lower incision I'll give a linear cautery. So this will contract and create a depression which looks very natural. And the last, very important, I have to check the symmetry. So I have to see from behind that everything is okay and it seems very symmetrical, or I can do some measurements with a scale that my crease is equal. So this is the part of the blepharoplasty, that you should achieve a very good symmetry. And last is we use a very fine sutures. We'll use a 60 or 70 ethylon, and we always do the key sutures first. The suturing is always a running sutures from one end to the other, but I always apply 3 key sutures, 1 in the center and 2 on the sides. Then after I do the running sutures. You see the skin is approximating very nicely without any tension, and there is slight eversion of the upper eyelid. That is important, because if you remove less of the skin, the patient is not happy. He or she will say there is, oh doctor, there is still a loose skin. So what is the measurement? So it is the pinch test I have done with the in the marking, and during the surgery when I apply the stitch, this upper eyelid is eye is slightly opened up. So this is the thing. This is the innermost key suture to approximate the landmarks, and we have to follow the Langer's line. It is not always a straight suturing. ठीक है? नहीं खिंच जाए थोड़ी सी eyelid कट. साइड पे थोड़ा सा इंक्रीज हो सकता है कि डिजाइन दिया So you should prioritize to choose your doctor wisely, because in cosmetic surgeries the doctor has to be a plastic surgeon and who is doing only aesthetic practice for minimum 10 years, and you should see many before and after pictures of the actual results of the patient, and the actual consultation is again important. So you should be also comfortable the doctor has answered all your queries with surgical steps. If you want to see the surgical steps the doctor has shown you.
Operation theatre has to be modified.
And second thing is the center, because there are many clinics which are in which the operation theatres has to be modular and accredited. So we are lucky in Kaira Aesthetic Clinic. We have got a very good infrastructure which is the world class, with all the latest equipment, and the safety of the patient is again a priority. We have round the clock anesthesia doctor with us, so all the procedures, even if it is under local anesthesia, is done under the supervision of an anesthesia doctor, and the sterilization techniques and all the suture material, even the dressings, has to be from a very good source. So you can see it has come out very nicely. So now I'll do the running sutures to complete on one side. Over the time we have become very experienced in this procedure, because the most important is the tissue handling. So we have to use the micro instruments, and we can also use the magnification. I'll use the magnification in the lower eyelid, and the marking part, and the tissue healing is very important, and your scar should be in the crease. So it comes out very neatly because of the experience of the doctor, and because of the help of the staff and the infrastructure also. So I'm helped by very good junior doctors, and we have a team of doctors who help me during the procedure. All the surgeries are done by me, but I have to take the help of my assistant and wherever it is required. and all the important parts, the planning, especially is to where to say no to the patient and how to make a realistic expectation and what results are to be expected, because medical science is not an exact science, it is not the maths. So you have to evaluate your patients very carefully. You have to understand their psychology also, what they are expecting. Sometimes it is very important to say no to the patient also. So after this we'll do the dressing. So we'll do just a steri-strip dressing, a thin dressing. Patient can do all the normal activities at home, even she can watch a movie, and there can be some bruising or swelling for few days. So bruising and swelling is very less in the upper eyelid, but it is pronounced in the lower eyelid. So that is the only drawback. If there is any social meeting or you have to go out, that you should avoid for 1 to 2 weeks.